Hello, I'm Marc Stees. I'm a local dermatologist here in Dixon. I'm giving a presentation today on skin cancer and sun prevention. May is Skin Cancer Awareness Month, so I thought this would be a great topic to help bring about community awareness about this very common problem. Before I get started, I want to thank KSB Community Wellness and Aaron Fox for inviting me to do this presentation. Uh, Leading right into it, there are three main types of skin cancer. There's non-melanoma skin cancer, which are by and large the majority of the kind of cancers that I diagnose in my practice and across the country. And those are basal cell and squamous cell carcinoma. There also is melanoma, which is the most deadly type of skin cancer. And I will elaborate on all those in this presentation. There are also many other uncommon types that I will not cover in this topic, in this presentation. Basal cell carcinoma is the most common type of skin cancer, mostly on the head and neck. These types of skin cancers, they will grow larger and deeper over time. They almost never spread to other parts of the body. They can be treated with multiple methods. More complicated ones, especially those on the head and neck, I treat with Mohs surgery. I will excise them. And depending on the location, some of them can even be treated with a type of cream. Here are some examples of basal cell carcinoma. Usually, they have a reddish or pinkish appearance with dilated blood vessels. They often will bleed or scab. There'll be a recurring sore in precisely the same spot. Common things like bug bites or little cuts or scrapes, those will heal up and won't come back. But basal cell carcinoma and squamous cell carcinoma, which I will talk about here in a bit, both present that way. Squamous cell carcinoma is a little more aggressive than a basal cell carcinoma. As you can see, they are only 20% of non-melanoma skin cancers, and they are due to cumulative sun exposure. If they are large or if they occur on high-risk locations like the lip or ear, they can metastasize or spread to a lymph node. An important thing to keep in mind, if you or a loved one is immunosuppressed in any way, for example, if they have an organ transplant, squamous cell carcinoma can be particularly dangerous in these patients, and they have a greater tendency to metastasize or spread in this population as well. Squamous cell carcinoma presents on the body very similarly to basal cell. It will be a bump or a sore that enlarges, scabs, bleeds. And my rule of thumb for both basal cell and squamous cell carcinoma is if you have a lesion on your skin that does not heal up in a month's time, that is probably something that should be evaluated. Moving on to melanoma, most have heard of this type of skin cancer. It's the most deadly. The good thing is that it is very curable if it is caught early. The survival from a melanoma diagnosis is most dependent on the depth of the lesion at the time of diagnosis. That also provides the framework for treatment of this kind of cancer. Without exception, melanoma must be excised or cut or removed from the skin. And then depending on the depth of the lesion or the characteristics of it under the microscope, often a lymph node is checked. We call it a sentinel lymph node biopsy. And also depending on whether or not it has spread, there are certain versions of chemotherapy that can be used in the treatment of melanoma. Generally, to detect melanoma, you follow the ABCDE rule. If you have a lesion on your skin that is asymmetric, if the border is irregular, if it has multiple shades of brown, blue, black in it, if it's larger, generally we say greater than 6 millimeters or the size of a pencil eraser. And also an important characteristic of melanoma is that it evolves or changes over time. It will not look the same 2 or 3 months down the road from when you first notice it. Another interesting characteristic of melanoma is only a third of them arise within an existing mole. 2/3 of them arise as a brand new spot on your skin. And just another note is that you can get true moles, benign moles, safely, 30, 35, 40 years old. Once you're over that age, if you have a new lesion on your skin, it is definitely something that you should keep a close eye on or have evaluated. And this slide just demonstrates the characteristics of melanoma, its appearance. It's self-explanatory if you'd like to pause the slide and read it a little more closely. But as you can see, there's clear examples of asymmetry, the border being irregular, the multiple shades of brown and black and blue in color, the size of it, and also the bottom image demonstrates how a lesion will evolve over time. Melanoma can occur anywhere, but as you can see from this map that sort of shows most common locations, this is from a study that was done. The back and the legs are the most common locations for melanoma. Here's some slides demonstrating examples of melanoma. You can see the irregular borders, the multiple shades of brown and black and tan in these lesions. More of the same. The one on the lower right you can see is actually a deeper lesion that has ulcerated or eroded. That is generally a negative sign. So in summary, you should be concerned if you have a lesion that is enlarging and persistently bleeding, scabbing, or non-healing in nature on your skin. You should also be concerned if you have a new or existing lesion on your skin that is violating one of these A, B, C, D, E rules. Now I'm going to move on to sun protection. I think this is an important thing for all of us to do to help prevent skin cancer. We know that acute and chronic sun exposure leads to skin cancer. Also, for vanity's sake, using sun protection slows down the aging process. This is something that I always tell patients, and that it's never too late to start wearing sunscreen. It may take a year or two of faithful use to make a difference, but it can make a difference at any age. And there are other certain skin conditions that the sun can make worse, such as lupus or rosacea. In utilizing sun protection, we want to minimize ultraviolet light exposure. And the two main ways to do that are wearing sun protective clothing and sunscreen. Ways to minimize ultraviolet light exposure include avoid being outdoors when the sun is most intense. So this is generally from 10 a.m. to 2 p.m. An easy rule of thumb to remember is you should avoid being outside when your shadow is shorter than you. You should seek the shade whenever is possible, and also try to avoid using tanning beds. Another thing to remember, and many of you maybe have experienced this, is that ultraviolet light does reach the Earth's surface on cloudy days, so it is possible to get burned on a cloudy day. Sun protective clothing includes wearing a wide-brimmed hat, sunglasses, long sleeves, pants, very thin t-shirts. You can actually burn through those. They may only have an SPF of 4. And what is great about today is that there are many brands of sun protective clothing that can be found at sporting goods stores. They're generally lightweight and do an excellent job of keeping you cool and protecting you from the sun. My general recommendations for sunscreen selection is that you use something that is at least an SPF 30 and that states that it's broad spectrum on the bottle. And that means that it blocks both UVA and UVB light. I like patients to pick out a sunscreen that has at least one of these two ingredients, zinc oxide or titanium dioxide. It does not have to be the only ingredient, but it is a very good blocker and it works immediately after application. Other good Compounds that are broad spectrum blockers are oxybenzone and avobenzone. Generally, these will be included on the active ingredients label of a sunscreen. Another thing that's important is you have to use enough. A rule of thumb is that a shot glass or 1 ounce should be enough for the entire body. And a nickel-sized amount is what you should use for your face. It's also important to apply it repeatedly when you're outdoors for long times, and reapply after sweating or swimming. An important thing to do also is to try to apply it 20 to 30 minutes before you're going outdoors. If you're a very fair-skinned individual, it does take 20 to 30 minutes for the chemical blockers to take effect. So you may get burned in that short window of time if you're a very fair-skinned individual. Looping back, that is why I do recommend that at least one of the ingredients be zinc oxide or titanium dioxide. These are just a couple interesting things to keep in mind. If you want to look tan, there are many brands of self-tanner out there. This, I don't have a specific brand to recommend. It's often trial and error, finding something that you feel looks good on you. Another important thing to keep in mind is that if you are very, very particular about your sun protection, you should take oral vitamin D, because the sun is how you naturally make vitamin D. So in this part of the country especially, we don't get much vitamin D in our diet unless we go out of our way to eat fatty fish. So that is why I listed these recommendations for over-the-counter supplements. Another important thing about vitamin D is it is a fat-soluble vitamin. So I recommend that people take it with their most substantial meal of the day, a meal that has some fat in it so that it's best absorbed. So in summary, enjoy life, protect you and your children from the sun, and have any suspicious lesions checked by your primary care physician or a dermatologist. I want to thank KSB and Aaron Fox for inviting me to be a part of this. And please take care of yourself and your skin. Thank you.